If you've been told your knee pain is just arthritis, or your hip pain is just wear and tear, or your shoulder is going to need a replacement eventually, I want you to consider something. The place you're feeling pain might not be the real source of your trouble. I'm Dr. Kendall Christensen. I spend my career in sports medicine working with people who still have things they want to do. People who have done everything they were told and are still stuck. That's why I built Reforge Health. And that's what I want to talk to you about. If you're watching this, you probably know the old routine. The ibuprofen that worked for a while, then stopped. The physical therapy that didn't work or only gave you 6 good weeks. The brace in the closet you don't use anymore. Maybe the steroid injection that felt great for a month, then felt like nothing. And somewhere along the way, the conversation shifted. Less about how to get you back to hiking or pickleball or skiing or chasing the grandkids in the backyard, and more about waiting until you get worse, waiting until you're ready for a replacement. That's not good enough. You want to live your life, not just wait. It's not just aging, and there's a reason none of those treatments have actually worked the way you hoped they would. I built Reforge Health for the people in this exact situation. Patients who have been to 3 or 4 providers, tried everything reasonable, and are now looking at a surgery they don't want or being told to come back when the pain is worse. I'm a sports medicine physician. I've spent the last 10 years doing this, and I've performed thousands of ultrasound guided procedures, which means I see tissue in real time in a way most providers never do. I got into regenerative medicine because I was the patient. 12 years of back pain. Everything I tried gave me a few hours of relief and nothing more, until one doctor during my residency treated the tissue instead of the symptom. I got off the table and my pain was gone for the first time in 12 years. After that, I couldn't practice medicine any other way. What we do at Reforge Health is different from what you've probably experienced. And the first difference is how we do an examination. In this class, I'm going to walk you through 3 things that most patients have never been told. The first is that most joint pain has an incomplete diagnosis. Not because anyone is being careless, but because a standard evaluation only looks at the joint that hurts. What it misses are the contributing factors, the joints above and below, the tendons and ligaments around it that are damaged and driving dysfunction. Imaging rarely captures all that. Or it gets dismissed because something else on the image looks more important. And if you don't find it, you can't treat it. The second has to do with what steroid injections are actually doing to your tissue. This one surprises almost every patient I share it with. Most people have never been told this by the doctor who gave them the injection. The third is the phrase, "It's just aging." I'm going to show you why that's not a diagnosis and what trumps age when it comes to your ability to heal. If any of this is new to you, that's exactly the point. The class is 45 minutes, it's free, and is built specifically for people in their 50s, 60s, and 70s who want to live their life. At the end of the 45 minutes, you'll understand what's likely driving your pain. You'll know what questions to ask any provider you see going forward, and you'll have a clearer picture of whether what we do at Reforge Health fits your situation or not. Either way, you'll leave with something you didn't have before. There's no pitch in the middle of the class. At the end, I'll spend a few minutes explaining what working with us looks like for the people who want to take the next step. You can stay for that part or not. To save your seat, fill out the form on this page. You'll get the link to join the class in your email within a few minutes. The class is live. I'll be there to answer questions in real time at the end. For everyone who attends live and decides to book a strategy call afterward, I'm offering $100 priority patient credit towards your initial consult. I value people who take action, and it's an honest reflection of the fact that the people who show up live tend to be the ones who are serious about getting answers. If you've spent the last 6 months or 2 years or longer feeling like you've run out of options for your joint pain, I think you'll find this class worth 45 minutes of your time. I'll see you there.